Hello everybody, Harry Koster here with another Thirsty Thursdays, and that's Thirsty for Knowledge. So yesterday Earl talked about tennis elbow. So I wanted to really give a little bit of background on what is tennis elbow, because the majority of people that get tennis elbow really never play tennis. So it's not necessarily something that comes from playing tennis, but it can come from playing tennis. So essentially what it is, and the official term is lateral epicondylitis, or lateral epicondylalgia. So let's talk a little bit about that. So the lateral epicondyle is a little bony prominence that's right here. Okay, it's actually part of your upper arm. Okay, when you have lateral epicondylitis, that means there's an itis, there's inflammation of this piece of bone, but really it's the tendons that attach to it. A lot of times though, when it gets chronic, and that happens with a lot of people, it's really not an itis anymore, there's not an acute inflammation anymore, and that's why we call it lateral epicondylalgia. So those are just kind of the terms. So what happens here, so you have the muscles that lift the wrist. Go ahead and lift the wrist up there for me, Adrian. You can see these muscles. Go ahead and go back down and back up. You can see these muscles. So these are the muscles that are attached here with tendons here, but run all the way here. Muscle bellies are right there. And then they attach here on this piece of bone. Okay, so those are the muscles that are the problem in tennis elbow. So what happens a lot of times, it's an overuse injury. So yes, it can be from backhand in tennis, but it can also be from using a screwdriver a lot, using a cutting board. So housewives can get this from cutting too many vegetables to put in the meals or anything like that. It's really repetitive use of the forearm, especially when done incorrectly. That's what causes tennis elbow or lateral epicondylitis. So it's these tendon insertions right here that will get to be very painful. Now there's a couple of different tests that we do for this that can easily help diagnose it, that it's it is tennis elbow. A couple of them are, so there's one of them, bring your wrist up like that. I'm going to hold this, I'm going to push this down, he's holding it up. If that creates pain here, that would be one positive test. Another one is where he actually is in this position. I'm going to have him extend that middle finger, so flip me off there, Adrian. Good. Again, if that's painful in here, that would be the second, positive test. Okay. Then there's, another test that we do, and I'm going to put my thumb kind of on here, and now I am going to, bend the wrist like that. Same thing here. That's painful in that same area. By now, if all three of those are positive, you're probably starting to look at possibility of tennis elbow. Okay. So that's, those are some of the tests that we're doing. So from a therapy standpoint, what we're going to do is, first of all, make sure we do local treatments, to help with pain and inflammation. So that would be, maybe some icing, if it's, more chronic, maybe heating, possibly maybe doing some ultrasound or something like that on. But a lot of it, actually, what we're doing is working on those tendon insertions and then letting them heal up. So one of my favorite techniques, not my patient's favorite techniques, but my favorite techniques will be do some cross friction on that. We definitely do a lot of stretching, and I know Earl's, showed some different exercises yesterday. This is probably my favorite stretch in here. The other thing that we really do a lot of times is making sure that when somebody goes back to their activities, that they do this in a better way. Maybe with more interruptions, maybe with some stretching in between, but also make sure that they use the tools the right way. Or if they're tennis players, make sure they, hold the racket the right way. So that's just a quick little update on tennis elbow.